This session will provide you information for each branch that can help you to make a decision that which branch that you would like to study for the next semester that you have to register. Okay, I would like to invite our Deputy of the Dean, Associate Professor Dr. Watasit Siriwong, will open the session.
So now we have about 26 people here, and also this is made combined between the new student. Yesterday we have the new orientation for the second batch of our college, 13 people, and also together with our current student. Today we would have, like we have the virtual orientation yesterday, and also we have today introduced about the branch that we have at the college. I'm already talked yesterday about the in general of our program, but I would say again, because of our current batch may need to know. This is our curriculum philosophy, curriculum philosophies of public health and public health science that you may know. Everyone know that we have both public health and public health science. We need to develop human resources to be morally literate, as well as to promote lifelong learning for more capacity in responding to the need and sustainability to help solve social problems on public health via qualities. Now, this is our curriculum for philosophies that I talk to the new student, and we also going to have the new curriculum in next years that we try to adjust and put something new like lifelong learning and more sustainability. So this is become our current curriculums. As you may know, today we would great opportunity to have all Ajahn, most of Ajahn that take care of each branch to talking about their branch and introduce about some detail and have the questions and answer for our student, especially for the new student can receive this message. Perhaps next semester you will have select for the course, and I think this semester you may pick up one course for your study as a selective course, and this would be let the idea for you to make a registration. And our current students, I mean for the first batch of our college, this is a time that you need to pick up the branch that you may interest. And I learned that last week it is a deadline of registration. Some already almost all done on registration, but we still have to add and to give up some course that you may do after the new open semester 2 weeks. So anyway, today we have all Ajahn here to talk about each branch that health policy, community health, urban health, environmental health, and health behaviors. But the sequence is different, like I talked earlier, but we have the schedule that I provide to all of you. Once again, for sure, for master degree program that we have to plan plan A and plan B. We have plan A 36 credit, but I think in this batch we have no one to learn with plan A1. We have just only plan A2. Make sure that all the students understand the credit, total credit for MPA should be 36 credit. For thesis is 12 credits. And this is the thing you need to concern. And I think some of our students, I mean for the second semesters, you start to register about the thesis. The thesis you can talk with your advisors about the credit perhaps this semester 6 credit, another semester is 6 credit, or 3 credit this semester, and the other is 9 credit. Total is 12. Anyways, for the core course, for the new batch, I think we decide for the core course for you for registrations and current batch. In total, 15 credits. That means for 5 subjects, you need to make a registrations. Major compulsory course 6 credits. That means 2 subjects, and elective course for 1 subject. So today, when we learn about each branch, you will know about which one should be the major compulsory course and elective course that you need to pick up. And for PhD student, we have the plan like this. In general, you need 72 credits, 72 credits, and seem like MPS student, make sure that for stream 2.1, you need 36 credits for dissertations, and 2.2, 48 credits. And the difference in each plan, the numbers of credit that present here, 6 for core course, compulsory 3, and elective course for 3 credits. That means 2 subjects, 1 subject, 1 subject. And this is for course first. This is, I think, we don't have students in this plan. And scheme that you have thesis only, it is 48 credit. This is consult with your advisors. No need to choose any courses in the college. But if you need to attend, it's okay. You attend, or this is as we, is fine. This is basic that you need to know. And then after this, in each branch, all professors would be present of their own branch that they take care of that. I would open the event for today, and feel free to have the questions, and all Ajahn here is feel free to give you the answers.
Good afternoon, everyone. My name is Dr. Pamon Viwathana Kunwanit, and along with Dr. Montakan, today I would like to present, introduce about the branch Community Health Development and Reproductive Health. In this branch, we have 2 main courses. The first course is Community Assessment, and the other one is Reproductive Health. So let's get into details of the first course, Community Assessment. So I think everyone know that we study about public health, right? And we tend to focus on the health of the population and health of the community. And we would like to make people have better quality of life and live longer. So that's why understanding community is quite important. So in this course, we provide you the basic concept of community structure, and how to approach community. And you will learn how to do the mapping. This is the important tool as well to do the community assessment. Some of you may, not sure that you have experiences or not to do the community mapping, social mapping, or family mapping. This is the tools that to get inside information in the communities. And you also learn from the topic about cultural dimension of community participatory analysis, and along with other topics. And in this course, we not just only provide you the knowledge, not just only learning, right? We also learning by doing. what does it mean by learning by doing, because inside this course, we also offer you the field trip. You can see on the right hand side of the picture that you can see our CPS student went on the field trip to see the real situation, to talk to the community. I think it's really important. But for this semester, we will take a look again during the COVID-19 situation, how can we manage this? And we also have the experts who've been working in the community more than 10 years. I will start with Dr. Ratana, Professor Dr. Ratana Samrong Thong. I think all of you might know her really well. She's been working more than 10 years and know about community really well. And also, we also have the guest speaker from the US, Miss Andrea Rothenberg. She's the director of the Sunny Mount Hospital. She will provide you the insight about the community in the global view. I think you will learn a lot from her. She's a New Yorker, and she's really friendly and nice lecturer, along with the young staff like me and Ajahn Montakan to support about this course. And for the next course about reproductive health, I think I will hand over to Dr. Montakan to tell the details about this course.
Thank you, Ka. Thank you, Ka, Ajahn Pramon. As Ajahn Pramon mentioned that our branch is focused on two main subjects. The first one is the community assessment, and another is about the reproductive health. So for reproductive health, the subject is designed to provide them understanding of reproductive health and population issues, as well as the knowledgeable necessary for reproductive health intervention. The subject will also explore the national and global challenges that related to social, economic, or even a cultural context that influence reproductive health. And in each session, you will be introduced to the interesting topic as shown in this slide. For example, the basic knowledge and enhancing accessibility to reproductive health, family planning, maternal and child health, adolescent health, unwanted pregnancy and abortion, preventing HIV/AIDS in young people, cancer in reproductive system, aging care, or even violence in women. And by the end of the course in our branch, the students are expected to be able to conduct the assessment in the study community. As Ajahn Pramon mentioned, that the best thing is doing studying by learning, doing things. So you have a chance to visit to the community in your study area, in the area setting, and you will explore your community and also reproductive health issue as well. And in addition, you will gain understanding and analyzing the reproductive health problem or reproductive health situation in your study area, and also the solution for that problem for enhancing access to reproductive health care services. So in our branch, in our course, we learn by, how to say, it's not only the lecture thing, but we need participatory. As you know, we are from the different cultures in different countries, so this is the best way to share and exchange the experience, including, I mean, in terms of the community and reproductive health issue. It is going to be beneficial for you and for those who are interested in reproductive health and community assessment topic. I think our branch is very welcome for you too. Thank you, Ka. And I see that we Ajahn Ratana also
Yes.
in this meeting for reproductive health. She is the one who are the main instructor for each session, and also the special guest lecture, as Ajahn Pramon already mentioned. Ajahn Ratana, would you like to add something for this branch?
Good afternoon, all. I think all of you present all the detail of the course, but one thing that I would like to encourage, because the community health and reproductive health is, I think, is an important issue. Even the one that didn't want to start, it means like the thesis is not related to this topic, to others topic, but you are welcome to register as a kind of the elective course as well. Thank you.
My branch, environmental and occupational health. In general, we have mainly, like we have Ajahn, me, myself, Ajahn Kaiwood, Ajahn Poket, and Ajahn Natha, and Ajahn Natha also take care of the branch of urban and global health as well. So mainly we have introduction to environmental health, or the code is 538. This is talking about in general of public environmental health problems. We try to pick up the problem in each country more internationally, not focus just only like I lived in Thai, we forgot in Thai. No, we try to look at the global issues like climate change, the industrial impact, air pollution, waste and like sanitary, something like this, and pesticides. This is global issue that we have. And also we have sightseeing. I think that in next semesters, we may have a chance to go to see like site visit. Every year we take the student to like industrial estates or some factories. So this is the activity that we have, and we have like presentations as examinations, right? And we have assignment for each sessions, and like discuss talks and list some issues. And last class we have student presentations, as I think this is meet the requirements of environmental health. And also we invite other Ajahn professional, international consultants of us, Professor Mark Robson and others colleagues that to join our class, like in environmental and occupational class. And I think for Ajahn Natha as well as Ajahn teach in the past of the occupational health in the subjects of environmental health. Ajahn Kaiwood talking about epidemiology in environment, but now we have another selected subject that you can fill in more in the ID 539 that Ajahn Kaiwood is the coordinator of the subject and main instructor of the subjects. And I would tell more about the second subjects that I teach by myself and other Ajahn Natha, Ajahn Poket, and Ajahn Kaiwood in the environmental and health risk assessment 541, that talking about the qualitative health risk assessment and quantitative health risk assessment to evaluate the impact assessment. You may know about environmental and EHIA. We talk about HIA, health impact assessment, and also environmental health impact assessment. This is one of the tools that we use around the world, internationally used for evaluate the impact of the pollutant to humans by exposures and qualitative evaluation. We use the metrics, and we have the activity. We have the scenario for the student to learn and to practice together. That is in general that we have in this branch. And I think Ajahn Kaiwood and Ajahn Boket or Ajahn Natha may add some information about this branch. As well as we have in each subjects, we plan to have site visit. Actually, for every class in the college, like selective course, we plan to put sightseeing as well. If we have a good chance, I think this semester, this coming semester, we would go somewhere. And we are very welcome for other branch to join the trips. Usually one day trip, go in the morning and come back in the late afternoon. That is, I think I covered. And other Ajahn in the branch, please come.
Okay, thank you, Ajahn Wattasit. As Ajahn Wattasit just mentioned about the courses that we provided in this branch, you may see like Introduction to Environmental Health, Environmental Health Risk Assessment, and Environmental Occupational Epidemiology. But as you may see that Ajahn Wattasit and I will take care of this branch, right? But we also have other lecture to cover for their topic in this branch as well. Like Ajahn Boket, she will cover on the heavy metal and health part, assessment, right? Environmental heavy metal. And Ajahn Natha will also talk about occupational health and some part that related to global health. Because, you know, like environmental health, this kind of thing, it's kind of like multidisciplinary. It's like global issue, it's like urban issue, it's like individual health as well. So things are combined together. And Ajahn Wandi will also take a charge in the food safety part, which is also included in this course as well, right? And the class that I take care of, it's environmental and occupational health epidemiology. You know, like as we know that like nowadays people exposed to various kind of environmental agent. Like you may heard about PM10, PM2.5, like the atmospheric air pollution that cause a lot of problem to your health, right? So in this class, in the epidemiology class, we'll talk about the dynamic and progress of the health outcome after your exposure. We will teach you how to study the exposure, how to design your study. You know, like epidemiology, it's kind of core of public health. It can apply to any kind of public health study. And now we apply this to environmental and occupational health study. So you will see how you conduct a study, how you're going to plan your study, what kind of environmental exposure that related to your working life, related to your daily life environment. Okay, and for my own research study that's related to environmental and occupational epidemiology, I'm more focused on this part, which is air and health, like bioaerosol, things like fungi, bacteria, toxins, allergen in the air environment, how it's impact to your health, how it's affect to your health, right? And we also talk about indoor air quality. We talk about GIS, Geographic Information System, if you may heard this before, how to use the software like mapping software to help you to look at the distribution of exposure, like environmental pollution or health distribution, something like that. And in my class, if you look at the schedule, I also provide a schedule for you here, so you can make a decision whether you will interested to join this class or not. As I mentioned, I will teach you how to design a study. of course, you know, like study design, if you study in public health, study design is like back and forth in so many subjects. You will learn it again and again in every classes here. However, until you do it by yourself, you will never know it until you do it by yourself, right? So this class will more emphasize, teach you how to conduct a study, how you can design a study that you can really do it in the study, okay? How you're going to control for variable that you're going to collect, how you're going to collect the sample, like environmental sample. Of course, in this class, it's more like progress of disease and impact of environment and disease. But eventually in the future, the course that I will offer more would teach you more how to assess the exposure, how you do sampling, how to collect the sample in the environment. But of course, in this class, we also give you the introduction of like how to assess the environmental agent and exposure, how you're going to assess the health outcome. And we also teach about epigenetic. In this part, Ajahn Anchali will help me to give you more detail of how the environment impact on your genetic, on your DNA, how chromosome, how cells will change after exposure, and what's the consequence of that. Okay, and we also teach you how to interpret the epidemiologic data. Of course, when you read the paper, you have to, you will see a lot of information in the paper, right? Odds ratio, relative risk, whatever, and how you're going to use those data, how you're going to analyze and interpret this kind of data. And we will teach you how to write the report, which is very important. You conduct a study, a very good study already, but if you don't know how to report it, then it's useless. No one understands what you're finding, what's the importance of your finding, right? And we also talk about occupational health surveillance. If you have to monitor health in the workers, in the environment, how you're going to do it, what kind of information that you need to concern. Okay, and no worry about the examination in this class. We don't do exam here. We do presentation. You have to understand what the whole things that we teach in the class. You have to understand the study, doing the presentation, do the critique papers, how to read the papers and present which part is good, which part is not good. You agree? If you not agree, how you're going to suggest that. And you also will have chance to learn from invited speaker as well. Every year, I will invite some professors, both in Thailand and overseas, to give you a more aspect and wider aspect of environmental health, environmental epidemiology, so you can learn more from various type of study that related to environment. Like last year, we invite Professor John Wu from Taiwan to give more detail on greenness, like greenness, how green of the environment and the consequence of health after exposure to greenness, like that, GIS, like that. And last semester, we have Dr. Jimmy from Gene Wellbeing and Mr. Gawan Health Group to teach you about environmental heavy metal exposure and health in urban environment among like people like in the city, like that. So you can have more idea of study that's related to this kind of things. Okay, that's all for this course. So if you're interested or if you have any questions, just feel free to ask. And yeah, that's all.
We use this book for main materials.
Your background, it's the same with the screen, so it's difficult to see. Look at here. Yes, in here I also have the reference here as well. Okay, the one that Ajahn Wattasit show you is environmental health book. This one is very popular book that you widely use when you study environmental health, and it's pretty thick, but cover all kind of information related to environmental health as well. And I also provide this one epidemiology book, which is the most popular epidemiology book that widely used around the world. with this occupational epidemiology book as well. So yeah, choose us. Choose our branch. And well, I don't want to like hard sell on that, but you know, like if you're working in the environmental field, you will have chance to like, well, of course, like participate in the international conference overseas. We have a connection. We can send you there with yeah, with a budget of study of you know, like doing a research and participate in the conference as well.
And the good news, if the country is open, you can go abroad. We usually send our students to study in abroad, like in the US and also somewhere in Taipei.
Yes, sure, of course.
We have overseas connection.
Exactly, as Ajahn Wattasit mentioned, if you're interested in Western, you may go to the US, may sit in Professor Mark Robson laboratory, like in Rutgers University, right? We also have other connection in the US as well, in Emory, right? Professor Dana and Professor Parinya, right? Yes. We also have a connection in Taipei with Professor John Wu at National Shen Gong University. We also have a collaboration in National Taiwan University, one of the top 100 world university as well, with Professor Liang, who is expert in environmental and occupational health, world-renowned scientist. Or if you want to do a postdoc, yes, of course, like if you like feel like to have research collaboration and potential your future postdoc position, you also can consider this as well.
So for my branch is the urban and global health, but for myself, I would taking care on the 5, 7, 8, which is like the introductions to the urban health one. What we're going to like teach you guys, or what we're going to learn in the like urban health course is that the components, if you look at here, right? So the main goals for this course is that we would like to like create the better health for the urban life. So that is the target one that we're going to like achieve. Like, so we have to like quite learn on like several things. I mean, like it's quite like the multidisciplinary one on the urban health issue, because like only one science, I mean like only one branch, we cannot like achieve all, right? So that is why it is composed of like multiple things like this. The first one that if you attend, I mean like if you join us in the urban health class, the first one that you're going to learn is on the urban environmental health. So as like I have to say first that I'm the environmental person, so that is why I just like quite involved in the urban environmental health one. So for this urban environmental health one, we're going to like include like the climate change, the air pollution, not only outdoor but also indoor as well, and also we're going to touching on the built environment and the housing one. So we're going to like look into the details that how these kind of things that can be like modify or like manipulate the urban health of the people. And after we learn that how the like urban environmental health going to be changed the urban health, I mean like the urban life, urban people life. So we have to like go into detail a little bit on the urban community design. So how we're going to create or how we're going to design the urban communities to create the better health from that. And also, if you look, I'm not going to like go by one, I might be like jumping to like left and right. So if you look on the right hand side, is that we're going to talking on the like urban food security, because like if you know, like if we are living in the urban community, so we can like easily like go to the like kind of the junk foods. And also if you are in Bangkok, so you might be like famous with the kinds of the street food as well. So we're going to learn that how the urban people eat and how that going to be modify the urban people life as well. So for the urban food security, we're going to touching on the nutrition and also like the food poisoning, which is related to the infectious disease as well, but not only infectious one, non-communicable disease and NCD, we also touching on that issue as well. So that one is on the urban food security. And also the other ones that we have to talking on is the urban health equity. So how we're going to create the equity in terms of the health of the people. So as you know, like if you are living in the urban one, so they're going to be like quite differentiate between like rich people and poor people. So we have like urban poor who can like be these serve as the worker in the urban area. So how we're going to like integrate, or how we're going to like use that to the tools to like make the urban poor people to have more equity in terms of the health as well. So that one we would be covered in this course. And the next one is touching on the vulnerability population health. I mean, like the vulnerability words is that we might be like talking on the elderly people, we might be talking on the children, women, and also the sexual harassment that in the urban area, how this thing can be happen, and what is the situations of the elderly in the urban area, and how the children life, what is that, right? Especially like in this kind of the COVID situation, like, so you might be like, know that the children have to go to school, and how we can like change, or how we can like just try to protect our children from the COVID-19 situation. So that one we would be covered in this issue as well. And also we're going to have like the women issue, like for example, like if you are the pregnant, or if you have like to like living in the urban area, so how your life is going to be like different if you are living in the urban and the rural area. So that one we would be covered in this one as well. After we learn all the things on the urban health issue, we're going to be like sum up on the thing on the innovations from the urban life. So this one we would be like just try to like involve the kinds of like we will learn, I would say like we will learn how we're going to integrate the innovations for the urban life of the people. So this one we're going to be like involve the step of the innovations things that would we call like 4D. We're going to be like cover on the discover, define, develop, and deliver as well. So this is the concepts on the urban health. I mean, like the concept of the course in the introductions to the urban health issue. And the one that are going to be like in charge, I mean, like the main coordinator is I myself, Nata, and also I have like Ajahn Wandi as the co-coordinator as well for this course. And what else that we have is that under the introduction to the urban health branch, we also have the collaborations with like many organizations, both like inbound and outbound. I mean like both in country and outbound, I mean like the other country as well. We are under the for example, like we are under the research unit, like we can call like House IAQ, which is the research unit that focusing on the indoor air quality, which is under the Chulalongkorn University. That is the multidisciplinary research unit. We involve like faculty of medicines, we involve like faculty of engineering, and also the the outside organization of the Chulalongkorn University as well. So that is the research unit which is under our branch. And also we have like collaboration with the Ministry of Public Health, which is like Department of Health, and also the Department of the Mental Health as well. So these two, we're going to working on the insights in terms of the research issue that we are interested. Right. For example, like I myself, which is in charge in the indoor air quality standard of Thailand. So that one would be under the Department of Health in the Ministry of Public Health. And also for the Department of Mental Health, we also have like some collaborations, not only like for the education side, but also for the research side as well. We also have that. And we also like under the I would say like under working on the some collaboration with the Department of Collections. That one we're going to like look into the how the COVID situation in the Department of the Collections have, I mean like in the jail, what is the situation of the COVID situation, and how we can modify the air quality in the Department of Collections to like maintain or to give the better health for the person who are living in the jails. So that one is like under negotiation. I mean, like that one is under working on in terms of the details with the Department of Collection. So this one is might be another opportunity for the field visit. We might be able to visit the jail in Thailand if you are living in Thailand. So you might be able to visit them to look at that, what the situation inside that. And also we not only have like insights, but we also have like collaboration with the IOM, which is under the UN migrations as well. We invite some person there to like give a lecture in like our branch. So just to give you an idea that in terms of the IOM, so what do they do, right? So what is the things that they have like involved in kind of the urban and global health? Not only IOM, we also like cross contact with the University of Tokyo. So at what we understand is that in this coming year, some students will be like visit us in like around February. So our branch will be like corporate in terms of the field visit together with the University of Tokyo student. So we're going to learn together that what is the field visit that going to be have. For example, like some issue that they might be interested, like the sugar tax or in Thailand, or it might be like the migrant issue in Thailand as well. So that one we would be like corporate in terms of the field visit together with this. And also like we have like some collaboration with the pollution control department. I'm the one who are working on the revised standard of the PM 2.5 in Thailand. So that is why if we would like to visit in terms of the environmental health thing that related with the air pollution, so we might be able to like talking on the pollution control department as well. And inside Chula, actually, we have like collaboration with the Faculty of Medicine and the Faculty of Engineering. As I mentioned, like, it is under the research unit that I involved in. And also we are like work closely with the Environmental Research Institute as well. And also the other university in Thailand, we also have like working with the Institute of the Metropolitan Development, which is under the Navamindra Parachila University, which is a quite new university in Bangkok actually. So that one will be like touching on the urban health issue. And also we have like some collaboration with the private organization, which is we call it LIST, the Research Innovation and Sustainability Center, which is under the one of the big like real estate development in Thailand. So we have like some collaboration there as well in terms of like research. So we gonna have like definitely like in the urban health and urban and global health, we quite have like several collaborations so that we can working with in the in this kind of the branch. So if you would like to know more into the details, so you might be like scan the QR code and then you might be able to contact me via line. That would be like great if we can like talk in the like further information. So I'm looking forward to see of you guys. So I would like pass my like to Ajahn Wandi for the global health issue.
So good afternoon once again. My name is Wandi Siricho Chachawan and I'm the coordinator for the Fundamental to Global Health. I would like to mention that if you look at our branch in the college website, we will update soon, so it's still on the old subjects, but actually we don't have the old subject anymore. So we have the Introduction to Urban Health and Fundamental to Global Health as in 5300578 and 579. So the website will be updated soon. Sorry for that as well. So for me, I'm responsible for the course on Fundamental to Global Health 5300579 again. So for this course, Fundamental to Global Health, I will provide you with an overview of the most important health challenges facing in the global today. We're gonna talk about what are the world major health challenges, what contribute to them, what can we do to improve health outcome and reduce the health disparity. And you will also gain the insight into how challenges have changed over time in our global situation. And we will also discuss the likely determinants of those changes, and also examine future projects to answer the changes of the health challenge in our world today. Not only that, but we will also discuss on the main 5 questions, such as like, what do people get sick? disable or die from? Why do they suffer from these conditions or that diseases? Which people are most affected, and why should we care about such concern? The least part, the most important is what can be done to address the key health issue and in sustainable way. As you may know that today we are really focused on how to make the solution sustainable, right? So the cost will be global in coverage, but not only that, we also focus on the low and middle income country as well. So the health of the poor and health disparity are in the focus of the cost as well. So particular attention will also be paid to throughout the cost to the health system, right? Health system issue and the linkage between health and development, and the matter related to global interdependence. Lastly, we have to discuss on the successful international strategy and program that can promote the human health and highlight global governance regarding the structure that can happen in the world or in particular countries. So we not only talk about that. When we talk about the successful program, we have to incorporate who are the key actors involved in those program or challenges or campaign. So for this course, what we focus on is 5 main issues like medicines. So medicine is like tropical medicine, non-communicable diseases, communicable diseases, and mental health. In the so as we know that global health actually is the core concept that incorporate like medicine, public health, international health. We also have nowadays we call like global as the super territorial, which incorporate the climate change and the globalization into that aspect. So we're going to talk about that as well. Come back to the public health aspect. We're going to look at the health surveillance, health protection, and health promotion. And then we look at the international health aspect, which is the sustainable development goals, which many, like all the countries around the world nowadays focusing on that, not only on the government part, but like the private sectors and the NGO sectors, and also the educational sector also focus on SDG or Sustainable Development Goal. So we also focusing on that. As I mentioned, like global as supra-territorial will be focused, and other disciplines such as like anthropology, interaction with the intercultural competency, and the social aspect like discrimination, violence, human rights. Those will be covered in other disciplines as well. In our class, we actually invite guest speaker like for last year we have the Deputy Permanent Secretary of Ministry of Public Health, Dr. Supakit Sirilak, come and talk about the universal health coverage using Thailand as a model. He gave us a valuable lectures, and we also invite other students from other classes to attend as well. So you feel free to attend if you are interested. If we have the guest lecturers, we will like announcement on that. So if other students would like to join our class, we are welcome for that. So that is like one related to the public health and the public health aspect, right? And we also incorporate like in urban health, we have innovation. Global health also look at innovation as well. Last class, we also invite Professor Thirapong, which is the Imperial College alumni, and he focused on nanoparticles as the health aspect. So he actually come up with many products regarding health using nanoparticle as an intervention. So it's related to the marketing as well. So for our global health, we not only focus on like how is like the lecture parts, but we also focus on how you can like look at the products as innovation to solve the global issue as well. So that would be one of the aspects. And this year we are looking forward to have like Professor Mays, which is the professor regarding the mental health, and he have like hundreds of publications and one of the leading researcher in the mental health aspect, and our collaboration with me as well in our project. So trying to invite him as to give a lecture, like special lecture on mental health. And also, so with that, we have the look at our collaboration. So this is some of our collaboration that we have regarding the global health research and connection. So actually, I'm under the diagnostic and monitoring of animal pathogens, but we actually incorporate One Health in that. So in public health aspect, we have that, and in our RU research, we actually have the other collaboration with like Sivila Hospital, Mahidol, and Chiang Mai University, and also we collaborate with the University of Bern, City University of Hong Kong, and Sydney University and many other university abroad as well. For my project, we also collaborate with the Faculty of Medicine regarding mental health projects and Department of Health, Department of Public Health, as in the Department of Health as in the involved in the sanitary and hygiene of the toilet standard of Thailand at the moment. And also we collaborate with engineering faculty of Chulalongkorn University regarding the projects on environmental health and antimicrobial resistance. And we also have global health connection with the Egg University in Notre Dame University in the US. And we collaborate on the big projects on AMR as well. So this is some of our collaboration at the moment. And this is our coordinator. So me as the main coordinator for global health class, like fundamental to global health class, and we also have co-coordinator as in Professor Natha, as you already know from her introduction earlier, and we also have other lecturer around Chulalongkorn University, like professor from ERIC, to come and talk about climate change, and like I mentioned, other guest lecturers, important guest lecturer as well. The antimicrobial resistance is actually on that slide is my my research interest and research collaboration and research topic that I am working on at the moment. So I'm working on the antimicrobial resistance project with like under the research unit of Chulalongkorn University, and also collaborate with other university inside Chulalongkorn and abroad as well. So we have that collaboration. So we look at the what are the microbes that resistant to specific antibiotics or antimicrobial agents, and also other aspects related to environmental health that link to antimicrobial resistance as well, especially in using the animal industry, using of the MR in the animal industry. Anyway, so thank you for interested in our course, and hopefully we can see you in our classes. So not only the malaria, but we also focus on other tropical medicine like tuberculosis, which I think is one of the disease that actually facing in low and middle income countries, and also coming up as the health challenge in the high income country as well. So this is me. And this is my research projects. And if you are interested in anything, you can contact me via email like 1d.s@chula.ac.th, or you can look at my CV on our website as well. So feel free to contact me regarding the class, and we are looking forward to seeing you all in our global and urban and global health branch. Last but not least, we're not open to this semester, but maybe next semester on the social innovation and entrepreneurship course. So we have many ajahn involving in that course. So it will be focused on like how you intervene, like you create one product regarding health and you market them, and how you gonna like build that using design thinking and other aspect of the marketing as well. Okay, ka. So that is me. Thank you so much, ka.
For this branch, for the health behavioral branch, so Dr. Montakan and I will talk together with the health behavior branch. And next is maybe Dr. Nutanat will be led for the mental health. Okay. So for this branch, you can see that for the instructor in this branch, so you can see that we also have the professor from the international as well. The first one that we call that Professor Linda B. Collar. She's from the University of Florida. And we have the Professor Peter. To lecture with us. And we also have the assistant professor, Dr. Usaniya, Dr. Sompot, and associate professor, Dr. Khemika, and again, Dr. Parmon and Dr. Montakan. And also we also have the professor from the Faculty of Science for joining us in this branch. So you can see that our branch is the overall of our branch to have the social and behavioral factors related with the health status and also have the behavior. And you can learn how to develop the intervention. It's very interesting for the PhD student, right? And promote health, prevent disease, and also the manage of the chronic illness. And the student is very important thing that you can learn and have a chance to contribute to current public health problems. And then for the other factors like the behavior, nutrition, physical activity, obesity, alcohol consumption, smoking, addictive substances, and also gender based on violence. That Dr. Montakan is very keen on this point. And this is also we going to merge it together with the concept of the theory that you might use in your thesis as well. Yeah. So for next, we have the compulsory subject that we need you to register in this course. So for the compulsory, we have the two subjects for the health behavior and the social cultural determinants of health. In each subject, we have the 3 credits on that. And elective subjects would be have so many subjects under in this branch. The first one is Dr. Montakan take responsibility for this course for the sexual behavior and socio-cultural issues in sexuality and reproductive health. And also I will take responsibility for 3 of the elective subjects. The first one is addictive behavior. The second one is the health and social impact on addiction, and also the health street study. And then we will talk a little bit detail. I'll start with the compulsory subject first. For this one, as we mentioned it to you for the health behavioral branch. So for the health behavior subject, it is the same as the health behavior branch, the same name of that. So and then, as I said, that it's a required course. So it's just for the welcome for the PhD student and also the MPH students. So this is an overview of the course. So as I mentioned it before, for the problems of the health behavior, and then forgot all the things that related to the health behavior, like the nutrition, physical activity, as I mentioned it before. So I will switch to the objectives. So the objectives of this is if you want you to see, if you have no idea for the master degree, if you have no idea for the topic of the thesis, so you can explore by this subject. This subject is overall of the health behavior that related for the nutrition, physical activity, obesity. So you can see that the second one is in to want you to assess about the risk behavior. and also the other addictive substance, and other things that are sexual transmitted diseases, and also the HIV. And the next one that I mentioned it before, you have to have the theory, because the theory is one of the topic of your thesis as well. But what is a specific theory that related to the health behavior? And the next one is for the factors and how to analyze of the chain of their health behavior. That is very important one. If you analyze, so you have to apply for your research in your health behavior. So, and then I would like to switch to the another compulsory course. Dr. Montagan, please.
Okay, thank you, Ajahn Jilada. So another compulsory subject for this branch is 545, social and cultural determinants of health. So for this course, we'll introduce you the concept and terminology associated with social and cultural determinants of health, and also analyze how social and cultural determinants or influence to health and well-being of the individual. You may have a question why why you have to study in this subject, because a person's health is influenced by a range of factors that we call determinants of health. These include who they are and what they do. Who they are in terms of individual factor like age or sex at birth is a genetic factor, and what they do, this includes their health behavior, as Ajahn Jirada already mentioned, such as smoking, or physical activity, alcohol consumption, or even dietary. So simply explanation that we can say that a person's health influenced by the condition in which that people are born, grow, live, or even work with, and also includes of social factors such as gender, ethnicity, education, social class, social economic, community network, cultural, even environmental conditions that people live in, and also health system as well. These are collectively called the social and cultural determinants of health. And the important thing is the social determinants of health are mostly responsible for health inequality, which is an unfair situation in which some people have more rights or better opportunities than other people to access to resource or even access to health services. So you can see within or even between the country in this subject. So we share together, and not only about the terminology, thing, theory, or even framework that you will learn from social and cultural determinants subject. You will be introduced the example of the program and policy intervention that aim at reducing the health inequality. And this slide show some of the example topics that we will share and discuss with you in our branch. That I am one of the main instructor involving with the Ajahn Peter Sinos, Ajahn Kenika, and also Ajahn Pamon involving in some sessions. So this is the 545 social and cultural determinants of health. Next is the elective course that I show you in this slide. So consists of 4. So I would start with this one. 543, sexual behavior and socio-cultural issues in sexuality and reproductive health. So we cannot deny that socio-cultural issue plays a major role in sexual behavior. It gives a better comprehension on why men are men and women are women, including other sexual orientation as well, which is so diversity in our society. It's not only the binary thing, it's not only men and women. Most people are attracted to opposite sex, like boy like girls, women like men, which we call that the hetero or straight. Like, but some people are attracted to the same sex that we call homosexual. The problem is once people perceive themselves as a homosexuality, it is forbidden in some countries and also have severe penalties in some culture as well. So you can see the culture is influence of the people life, the people health. It takes the idea that what behavior is are acceptable for one another. It might affect the health and illness of individual and community. So this course introduce you the importance of socio-cultural factors that influence sexual reproductive behavior, such as norms, value, tradition, health belief, communication, gender-related issues, sexual diversity, sexual harassment and abuse, gender discrimination, violence against women, exploitation and abuse. And also we may touch about the ethnic and law that related to all kinds of this issue as well. So to sum up for my two courses, as we are a human and we are a part of the society, we cannot deny the social and cultural effect to individual and community health. So spread your wings and explore the social and cultural issues with us. Let's join, sharing and exchange the experience together. Thank you, Ka. So this is for my two courses, and then I will stop sharing and pass the floor to Ajahn Kilada for the other elective course.
Yeah. All right. So for this one, for the addictive behavior, it is a 5, 4, 6. So this one is a selective course for the master degree and the PhD students. So it's about the addiction. It is maybe focus on the addiction behavior that is focused or thing like the pharmacology and the pattern of the model of their use, and then the nature of their dependent, the role, individual risks, and also the clinical. And the other policies might be its important one. And we also include the theories and the model of the addictive behavior as well. So let's take a look a little bit for the objectives of that. So it's focused on the substance, and the other addiction is might be included the risk behavior as well, and also the role of the individual risks of each one of the addictive substances and the other addiction. So, and we want you to know about the role of the health personnel and also the law related to the other substance or the other addiction. And this one that you have to analyze a little bit for the theories and the model of their behavior and the things that related to harm and the other factor as well. So this is the order of the addictive behavior. For the next one, this is very important for the PhD students, because I heard from the PhD student that what is the intervention, what is the prevention, and how do I create a good intervention as well. So in this course, it might have the answer for you. This is a course about the prevention, intervention, and evaluation of health behavior model. So the course number 549. So, and for this one, as I mentioned, that we will focus on the public health policy and the practice diverse settings for prevention, and also intervention and evaluation health indicator of the model treatment, and any model that we want to include, that is might be the others prevention and the intervention at the individual, family, peers, and the society levels policy and the other law enforcement. So, and this one is might be related to the overall of that one that I mentioned it before. You can see that for the second one, it is about the effectiveness of each component of the prevention, intervention, and evaluation. For the second one of the objective of this course is maybe, fit to the PhD students. So I would encourage you to register in our branch, and then you can, select for these subject, or student who register with the other branch can choose this course as well. And let's talk about the model and the prevention intervention as well. For the last one of the objective is very important one, because it's about the implement the model or the program of the prevention, intervention or evaluation in the individual or the other setting as well. For the last one, that selected course, so we call that the health street study. So the course number is 0577. So in this one, very interesting that for the college, we have there another sign that we call it the July Health Street at the Suan Luang Square. So you can see that the picture in the top, this is about the outside of the health street. And then you can see that the picture in the bottom, this is the inside of the July Health Street. And then this one is for students to visit the health street as well. We also have the other activity and the event that we going to help people for improving the quality of life of the people around Chulalongkorn University and other people. So, and then this one, we have the MOU with the University of Florida. So as I mentioned it before, so this is Professor Dr. Linda B. Cutler. So she from the University of Florida, America. So she is the one that to initiate the health street at the America, and then we have to collaborate together, and then we have the July Health Street in Thailand, belong to College of Public Health Sciences. And you can take a look for this. Professor Linda B. Cutler visited us as our health street in Thailand. And then we also have the other foreigner to visit the July Health Street as well. And we also have the Dr. Phuket here as well. This one is just the overall of this health street study. So as I mentioned it before, so you're going to learn outside of the college. So we use the health street center to provide your knowledge. We have just only, 1 or 2 sections for the lecture. And for the other section, we're going to, use your expertise and then create like a model, and then to implement or to use, that model that you created to the people around there. So this one that we call that the innovative community engagement study. So it seems like this study is for fun, that you can learn, and then you can understand, engaging, and then exchange your experiences with the community. So it's you can planning for the practicing, including for the other thing like the supporting people as well. And then it's cover for the quality of life. And this one just an overview of that. At least you can gain experiences on the community engagement. And then you can, have the relationship between the community and the health links. And then it's related to the, NCD for the all other things like the nutrition, physical activity, obesity, and so on. And then next is this course would like you to increase the skill of the planning and practicing. So you can take the good opportunity for this and take care for the people as well, and conduct a rapid community assessment. And the last one is very important one that you can see that for the create an intervention and prevention program for community healthcare. And I will show you a little bit for our activity. So your left hand side is the activity for the exercise. So you can, join or create the activity for the people, and then the people come to join your activity that you created by yourself. And then, in your right hand side, that our PhD students that register in this course, and then she, create the new event, and then it's very famous one. And then this is the last one for the slide that I have. So at the college, we'll have the event that we call the 4R event. That is an online event. So we'll open in the 25th November. So you can register by the QR code and this one. And then you can join us for fun. And then everything is free for the program. And this one, we have the collaboration with the other faculty as well. So you might notice for the logo on the top of the PI, so many logo on that. And then also for this branch, so I would say that we have the collaboration with the WHO Collaborating Center. So for the WHO, we have the WHO Collaborating Center for the research and training in drug dependence. And we also, this is international, right? And then we also have the national that we call it the Drug Dependent Research Center. So, and we have the research unit is the one that we work with, that is about the health and the social sciences and addiction research unit. So under the unit are Dr. Poke, Dr. Muntakan, and Dr. Wandi is under this unit as well. Yeah, that's all for the health behavioral branch. Very welcome that if you are interested for this branch. Any question? Very welcome on that.
Thank you, Ajahn Jada and Ajahn Muntakan. So for while you waiting for our dean, so I would like to sell my course also. Yes, this is the technology in public health. Any branch you can join this subject. We learned about the digital era, about internet things, and also medical technology, online communication, or robots, anything about the technology in public health. So if you are interested in technology in the digital era at the present, the new normal is coming. So we will visit some, if we can, we will visit the hospital or visit the some organization that have the technology or robots. So if you are interested in technology, please join this subject. That's all for this course. It's not a branch, so it is an elective course, not compulsory course. So anyone can join if you are interested.
So good afternoon, all of you, and once again, welcome to our program. Well, I think as you already heard, and all the professors already mentioned about different fields and majors and different tracks of your studying already. And so the last one here is going to be the health policy and management. As you may be aware that, management is one of the very important soft skills that most of everyone needs to have. So therefore, you know, once you are already in the field of public health, you need the areas of soft skills, which is management. And at the same time, it's not totally a soft management. It's a matter of a combination of soft and you know, solid skills that you need to have at the same time. So everything that you are dealing with, you know, will need to have management skills in here. So therefore, we have health policy and management, in the sense that, you know, all the students will have the opportunity to improve their knowledge in terms of the management. I think that all of you probably already have management skills to a certain extent, but different classes in this track, health policy and management, will help you to enhance your skill, and you will be able to apply it into the public health and medical fields. I would say that. So, unfortunately, I don't have the PowerPoint, but I can mention it to you that the main core course, there are two main core courses, 5300-508 and 5300-503. Okay, for 5300-508 is the public health administration. So in this course, you'll be able to, you know, learn and get familiarized with management, simple management model, strategic management model, which will be able to help you to understand the situation of the organization. It doesn't have to be the organization, public health organization. It can be a variety of organizations that you will be able to, you know, experience with, or even your own organization as well. So this course, 5300-508, will definitely help you to be able to understand how you can apply simple strategic management model into different type of organization. You will be able to experience your practice, you know, doing the simple strategic management into the different cases, and we introduce you with some games that you will be able to play, and also tips that will help you to be able to, for you to be able to understand the situation of different type of organization. Okay, so this way you will have the opportunity to exchange the knowledge, exchange the experience between friends, discuss with friends, and at the same time, we'll give you some cases that you will be able to, you know, analyze those cases of different types of organization. Okay, so then, you know, you will have the experience in terms of practicing your soft skills, in terms of the presentations, in terms of communication skills. All right. So I think communication is one of the main soft skills that everyone needs to have when you do the presentation, when you do the, you know, try to communicate with people. You need to make good presentation. At the same time, when you are in here at the college, you have the opportunity to you know, do lots and lots of presentation in different classes as well. All right. So that's the 508 cup. 5300-508. This one is 503.
508 is the core course, Public Health Administration.
Right. Public administration. That's what we were talking about, 508 at the moment, but now we are talking about that, you know, from 508 then we'll come to the electives. So from 508, then we'll come to 503. You know, this is the course, the main core courses, right? And then 503 will be the more of the policies. Okay, from 508, then we go to 503. Okay, which is related to more of the policy and strategic management in this case. And this way, you have the opportunity to learn in terms of the how you can form the policies, how you can apply different theories that you have learned in order to create policies for public, for private organization, and so on. Okay, so this one you will learn in terms of the principle and techniques, how you make the decision making and forming the policies. All right, and at the same time you'll be able to develop and understanding the public policies as they currently are, and at the same time to develop basic skills for agenda setting, for policy formation and policy adaptations. Okay, so this way, once again, you have the opportunity to practice your experience. Some of you probably will have the experience in terms of making your own the policies for the organization and so on, or even the government already. But you learn the theoretical part in terms of how you can continue to do that and understand as well. Okay, the next one is the 5300504. This is the implementation and management. Okay, so this one will emphasis on more of the implementation or applying it through health economics model. Okay, so this way you will have the opportunity to apply once again with microeconomic theories of consumer behaviors. Okay, look at the demand supplies and then try to apply economic theories into the public health. As you may be aware that public health, economic, basically you try to utilize the resources that you have, limited resources, and you try to make it to use it in the most efficient way. Okay, for this course, you will be I'll give you some backgrounds about basic economic theories, especially microeconomics, and then it will help you to be able to understand the behaviors of the people, individuals and all the players into the healthcare market. Right? From this way, you will have the opportunity to, to practice a simple economic theories. And at the same time, I will introduce you some tools like cost benefit analysis, cost effectiveness analysis. These are the tools that you might be able to use to apply it in different situations and how you can utilize the resources in the most efficient way. And I would say that 503, 504, okay, will be the electives for you to be able to to enhance your knowledge about management skills, which including economic skills that will definitely useful for you. Many of the public health or even health professionals don't have it. That's why this college is trying to, pull out some of the skills that is needed for all of you to be able to, survive in this disrupted world. And at the same time, you will be able to, apply in different situations to enhance your knowledge, to enhance the relationship, enhance the techniques and of communications that you can do within this health field or public health field. All right, so I would love to welcome all of you to, to pick and choose one of these electives. As you may know that you can cross register in different fields as well. We opened it to all of you, or if you might come and tell me that, oh, well, Ajahn King, the dean, I would like to sit in your class. Is it possible? Of course. Okay, even though you are not registered, but you are welcome to sit in as well for your own knowledge. All right, but it will be good if you registered so that it will be recorded on your transcript, so that people will know that, oh, right, at least you have been taking my classes or something like that. All right, but anyway, we have Ajahn Phoket, we have Ajahn Siripen, we have Ajahn Nitima, okay, who will be the instructors for these two courses and help me to make sure that all of you will be able to learn as much as possible.
Any lecturers would like to say something before we leave?
Just
Yes,
to
please,
say
Ajahn
that
Siripen.
make your choice, make your good choice. Today we try to give information for all students and pick up whatever you like and learn, and I think you will success in that subject and that branch.
Actually, you can just choose any class you want, like as an elective class, you can jump. You want to study global, you also want to study mental health or health behavior, you also can choose the other courses as the elective course as well. So no worry that you have to strict or fix yourself into this. You still have a room for elective class to choose as well. Just make sure that the time is not conflict, because for master student, you only have 3 semesters, right? One
year.
academic year. So you won't have chance to come back to choose the class again. But for PhD, it's okay, totally fine if you complete the compulsory in the first year already. So next year you can choose the other class from other professors from other branches as well. That's totally fine. Or you can even choose the course outside the department as well. Okay.
Yes. And I would like to remind again that the branch is just the divided by inside our college, but in your degree or in the transcript, when you graduate, it's not show the branch. So don't worry that the branch or the subject that you register, if you show in the degree or transcript or not, it just show the name of the course that you register. But it didn't show that you are graduate with this branch, it just show public health. All are the same degree. Also in the transcript, we didn't show any major in the transcript, just public health. So don't worry that when you choose, maybe it's not related with your research, or maybe you're interested in that branch, but you would like to register the other branch also, and how conflict between the major name in the transcript, don't worry, because it didn't show. Okay. And I would like to invite you to install the BOSU Connect application. I think the yesterday orientation, Ajahn Vatasit already show about the BOSU Connect application. This is a mobile application conducted by College of Public Health Science. So this is another way to communicate between our college lecturer and also student. So you can receive some information, receive some announcement, some workshop information, or any information about our college via the mobile application we call BOSU Connect. So you can download the BOSU Connect. Okay. Maybe I will send the link for you in the chat box later. So in the BOSU Connect, you can communicate with the supporting staff, such as the financial staff or the academic staff, or even the lecturers. You can communicate with them. And also you will receive some information about the registration course, such as some course you register, they have some maybe assignment or the announcement from that course. You can receive information from BOSU Connect also. So I would like to invite all of you to install the BOSU Connect application.